At Center Street Animal Hospital, we view dentistry as a really important procedure. Too many times we think it gets overlooked. We see dogs coming from other clinics and their teeth are really in bad condition. And I don't think people appreciate that dental disease is actually quite a severe disease. It's painful for them. So we regard it as something that should be done annually if people can afford to do it. We understand there are implications about anesthetics, but we're very, very careful to make sure anesthetic safety and patient care is a very high priority. Basically, our philosophy is the patient comes first.
At Center Street Animal Hospital, when we bring the patient through in the morning, there's several things we need to take into consideration when they're admitted. There's a few forms that need to be filled in. And after that, when they're brought through to the treatment area, we make some first assessments. We take their temperature, their heart rate, their respiration rate. We make sure that they're safe to go under anesthesia. And we also do some blood work testing to make sure, again, that they're safe to go under anesthesia, they can handle the medication. And those blood work tests also determine what type of anesthesia we can use or the route of administration. It's detrimental to the actual process.
We could do things a little cheaper, but we really want to make sure the patient comes first, and we want to make sure that the client understands that. And so a lot of the times we'll have a client a little bit concerned about the anesthetic, and they didn't do so well at one point, so they had a previous dog that didn't do well under a previous anesthetic, and the challenge is to make them sure that, or to make them aware that we will not go ahead with the procedure when there is a sort of some kind of crisis or some kind of risk involved. So we definitely have to filter out the risk factor first.
After we have all the information, when we make up the anesthetic plan to determine what we're going to do, how we're going to start. After the doctor has authorized the plan, we go ahead and do that. Usually it involves an injection prior to make the animal feel more calmer, that they're not as anxious. We don't want them anxious, we want them to be as calm as possible. Once we give them that injection to make them feel calm, it takes about half an hour or so to take effect. After that happens, we can work with them. They're nice and calm. And what we do then, we place an intravenous catheter on one of their limbs, the front leg or back leg. We usually have to shave a little patch on their arm. We place a catheter, and that helps us. So we have intravenous access for giving any further medication. They're on IV fluids, so it helps to keep the blood pressure up while they're under anesthesia. And it also, it helps us control the anesthetic. It's one of the control methods throughout the anesthetic procedure if we need to increase the fluids or decrease the fluids, and it does help quite a bit, especially with the blood pressure.
One of the things that I have found, and people are already pretty unaware of it, is there's actually quite a lot of oral pain that dogs have, or cats have, which they don't often display. You've got to remember they are animals, and their instinctive behavior is not to show any vulnerability. So one of the last things they're going to do is not be able to eat or show signs of weakness. And that includes in a domestic situation as well. Their outlook is very different to ours. They don't always have these emotional hangovers that we do. So their outlook is to be happy all the time, wag their tails when they see you, and interact very well with you. And when they're showing symptoms of oral pain and they stop eating, or they're drooling from their mouths, or you find that they can only eat wet food and not dry food, they're at a pretty advanced stage already. So they are, in my opinion, they are notorious for hiding pain. So when they don't have dentistry done, that pain gradually sets in, and it takes, sometimes some cats or dogs will take years for that to occur, or before they show any signs of pain. But when they get to that advanced disease that they need a dentistry almost on an urgent basis, the amount of pathology in the mouth requires so much work that it's sometimes difficult to salvage some of those teeth. And we go in there and we're busy cleaning the teeth, and some of them are hanging loose in the mouth, and there's pussy discharge coming from the gums, extremely painful. And even under anesthetic, sometimes you will feel, or when you're busy doing the probing and the examination, even under a stage 2 anesthetic, their heart rate suddenly elevate because they are feeling something. So just because they don't speak and just because their mouth may smell yucky sometimes, but they're still happy, it's not in your face and it's not in people's awareness always that they realize that their mouth is sometimes the primary concern.
When we start the procedure, we have a quick assessment overall to find out what's going on in his mouth. Because it's one thing with an awake animal to open the mouth and see, and it's a different thing when they're under anesthesia. You can actually use instruments to measure pocket depth if there's any abnormality, so you can much further investigate to see what's going on in the mouth. After we do that, if there's any abnormalities, we use what's called a dental chart, and we write these things down. If there's any abnormal pocket depth or a tooth that doesn't look right, anything that's out of the ordinary. In many cases, we see a lot of surprises, a lot of things that owners, don't see, or even us during the exam, we cannot see because the animals are not always cooperating, and you can't always look at that very last tooth in the back of the mouth. That's while the tongue is in the exam room moving its head or moving its tongue. When they're under anesthesia, we do see a lot of cases where there's all sorts of surprises, where there's abnormalities. If there's any abnormalities, we'll go ahead, we'll take an x-ray of that tooth to further investigate if there's something going on deep where we cannot see. If there's issues with the roots, with the structure of the root, with the formation of the root, all those things that we cannot see, things that are underneath the gums. After the charting part, we actually start what's called the dental prophy, which is scaling. We remove all the tartar or calculus. We remove that off the teeth using an ultrasonic scaler. What it does, it's a very high power, uses high power frequency, and it blasts away all the tartar and calculus, literally. And after that, we'll polish the tooth to a smooth surface. So it'll actually make it harder for plaque and tartar to stick onto the tooth, because once we scale the tooth, there may be still striations. They're microscopic, we can't see them, but there's actually little scratches on the surface on the enamel. So by polishing that enamel, it makes it harder for plaque and bacteria to stick onto it. We'll also do a subgingival cleaning to clean those pockets just underneath the gum where plaque tends to accumulate. So we'll clean those, make sure they're nice and clean. And that's all part of routine here at Center Street Animal Hospital. We'll do that as a routine, regular practice.
What we do try and prepare clients is try and get in the thought process of doing an annual dentistry. And the best way to explain that is with people, we're supposed to be going every 6 months. And that's just for a routine cleaning. We get to the dentist, we do an oral hygiene visit, and they take dental x-rays. And from a dog's point of view or a cat's point of view, the least amount of years per human here is 4 years to 1. With a bigger dog, it goes up to 7 years to 1. So if you're looking at doing a dentistry once a year, it's really the equivalent of doing a dentistry in human terms once every 4 or 7 years. And so when people say that their pet just had a dentistry recently, and we look back and it's 12 or 18 months ago, you've got to understand that it's at least 4 to 10 years ago that they've had a dentistry done. So our philosophy is try and do the most in the least amount of time and try and get the most benefit to the pet and to the client. So it's all value-added services that we try and include. Once they're under anesthetic, it's a standard procedure at our hospital, Center Street Animal Hospital, to do a nail trim. A lot of dogs hate their nails being trimmed. The groomers have difficult time with them, and sometimes requires 2 or 3 people to hold them down. They just don't like the sensation. Sometimes the little quick gets caught and the nail bleeds, and that becomes a problem for them in the future because they anticipate that it's going to hurt again. So it's an automatic thing that we include a nail trim at no cost every single time that there is an anesthetic done. We look for other things that may be smaller procedures that we could very easily do and put less discomfort in the way of the pet. So if they need to be under anesthetic and their ears are dirty, instead of them fussing, we can actually get a deep cleaning done. Sometimes there may be a small little growth on the skin that can just be laser burned off. And we're just able to do small little procedures while they're already under anesthetic. So again, what we're really focusing on is an all-inclusive, patient-orientated care.
Towards the end, we start to get the patient ready for recovery. We make sure they have a nice, quiet, cozy place to wake up. We'll get them ready for waking up. We'll disconnect or we'll turn off the anesthetic. It comes as an inhalant through the tube that they're breathing, so we'll turn that off, and so they're getting just oxygen. They'll slowly start to wake up. And during all this time, they're still monitored. There's a technician that's monitoring them, checking all their vital signs constantly. Once everything is done, they'll be woken up and transferred to our ICU, our intensive care unit. Well, they'll be monitored during the recovery period to make sure that they're recovering and waking up nice and calm, to make sure everything went nice and smooth.
Once the dentistry is done, depending on the severity of their mouth, we will sometimes need to put them on an antibiotic course. Sometimes they will even need to be on a course of painkillers because the gums are that swollen, or there's so much pain or swelling or inflammation that occurs in the mouth. After that course of medication, we always do as an included benefit with the dentistry is that we would get them in for a follow-up exam. Most cases it will be with one of our registered technicians just to see that the anesthetic recovery has gone well. Anything that is beyond their comfort level to say, oh, there's been a problem, or they would just like me to have or one of the doctors just to have a look at, we will always come in and we'll follow up as well. But the big thing is we're looking at anesthetic recovery at a follow-up exam 10 or 14 days later. They go through quite comprehensively about special diets that will help, how to brush teeth, how to monitor and do the best that they can. And we do a follow-up dental exam as long as the client is able to do so within the next 6 months. And if you want to do it more frequently, that's fine. Our big thing is anything to do with the dental exam with the technician or any questions that you have, we don't charge. So it just, our goal is to try and help maintain their teeth as best as possible right throughout the year. Everybody at our hospital really works well as a team. We focus extremely carefully on teamwork, not only in the healthcare within the hospital, and we're all on the same page. It really makes it easy. Everybody just knows the flow. This one's monitoring anesthetic, this one's cleaning teeth, this one's evaluating, this one's communicating with the client. And the second part of that whole thing is very strong client communications. We're calling the clients during the procedure if necessary. We're calling the clients after the procedure once they're in recovery, just to make them feel more comfort. We treat each patient individually. Their blood works are individually done according to what their needs are. So it's not just a number. So we really are, again, patient focused, and we care about our patients, and we love what we do.